G'day ladies and gentlemen, this is Fran Landman from Key Wealth, and here's a quick video on the Bestmed Pace 1 benefit summary for 2025. And I'm not going to go into a high level of depth with this, but I will briefly explain what I deem to be some of the most important things to take note of. So first off, let's start with the price, 5,706 Rand next year for an adult dependent. And then there are the rates for the first one was for the principal member. There are the rates for the adult dependents and the child dependents. This is a great option for a family that can afford it, that's got a lot of day-to-day needs, or that doesn't enjoy, to be out of pocket, or, if you want stuff to be comprehensively covered out of hospital. In hospital, it's also great, but out of hospital, this is a very, very rich plan. I also find this traditionally for any single parents, for this to be a great scheme, a great option from Bestmed. The price point is a little bit high still, but the adult or the child rates aren't that much, and then it activates the full family benefit. You can even split it if you're a husband and wife and 2 kids and you need a lot of day-to-day benefits. You can do the father and 1 child, the mother and 1 child on 2 separate medical aids, and then you essentially double your benefits for a small extra amount each month. So let's get into it. It's a 100% scheme rate option. In other words, if a doctor or specialist charges more in hospital, you can be liable for the shortfall. It's always where it's important to have a gap cover. Gap covers have become incredible vital role that they play in the medical scheme industry. So in the healthcare industry, I almost want to say gap covers are non-negotiable at these stages, or where we find ourselves now. So what you do have here is take home medicine. Bestmed always gave 7 days. You have to get that at the hospital pharmacy, at the dispensary of the hospital. So not a pharmacy at the hospital, but the hospital's actual pharmacy or dispensary. They've now added 200 Rand that you can get from a script from a retail pharmacy. So should you not be able to get it from the hospital itself, you can get it at Clicks or Discount or any other pharmacy later on. Then they also cover 34,828 Rand on biological medicines. That's very nice. And then the normal stuff, mental health facilities, chemical and substance abuse, is covered as it was in the past. So nice to know here is that maxillofacial surgery is covered. It's not covered on some of the lower end options of Bestmed. There's a limit of dental and oral surgery in or out of hospital. So just take note of that. If there is any wisdom teeth extractions or children under certain ages, that you do not exceed that limit. There's a very big prosthetic limit of 109,176. And you can find the corresponding sub-limits over here. So you can pause this video at any time to check. Some of the stuff that came on is dual chamber pacemakers for next year, and also Bestmed is now including their payment for drug-eluting stents, which was excluded in the past. So that's very, very nice, in my opinion. For the price that you pay for this option, remember it is great hospital cover, but it's still very rich in day-to-day benefits. And sadly, one of the stuff that's still not covered on this option is joint replacement. So hip, knees, shoulders, any major joint replacements is not covered on this option. It will be covered in the event of a PMB or trauma, like a vehicle accident or something like that, if it goes again, or if it is aligned with the medical, if it's the only option that you have, basically. So if the clinical definitions meet the PMB criteria, sorry for the fumble on my words there, if the clinical definitions meet the PMB criteria, then you will be able to get it. Okay, so something else that's here is that there's a 27,000 Rand limit per family for external prosthetics, so like an arm or a leg. Just take note that these things range from not too expensive to like hundreds of thousands, depending on the prosthetic device that you get. So it's nice that there's a benefit for it, but just make sure that if this is something that's important to you, that you check what the prices are of any limbs that you require. All right, so the next thing that's important here is specialized diagnostic imaging. It's been changed quite a lot. So Bestmed had a limit out of hospital, a smallish limit out of hospital, where you can get only like 1 or 2 scans maybe, or 1.5 scan probably, where now, and in hospital it was unlimited. Now there's a 40,000 Rand limit in and out of hospital. Again, it will be covered in full when it's a PMB. So out of hospital, this benefit has been enhanced. So if you're out of hospital, you've got multiple scans, which is great. In hospital, the benefit has been slightly reduced. So this is a very important thing where it's crucial to get gap cover. They've also added a 2,000 Rand co-payment per scan, again, something that can be covered with gap cover. So if you don't have a gap cover, please talk to us. If you do have a gap cover, talk to us to make sure that it covers co-payments on MRI and CT scans. Cancer is covered as it was in the past. Very important to remember that with cancer, there's a treatment plan that Bestmed releases. If Pace 1 does not provide cover, or the treatment plan is outside of the scope of Pace 1, you can do an upgrade within the next 30 days to Pace 2 as an example, or Pace 3, where you can get the required cover that you need or treatment that you require for your cancer. So very important to take note of that. Something that's also important to mention is that Bestmed will no longer pay for the non-cancerous breast. So this would be in a situation where you've got breast cancer in one breast and the doctor wants to do a double mastectomy. Then the healthy breast will basically only be covered under PMB guidelines. So should you want to do a double mastectomy, you can be a little bit out of pocket there. It's very important to include gap cover here. Not that the gap cover won't necessarily pay for the double mastectomy, or if there's a shortfall, but there might be a little bit of a disconnect between the medical scheme and here. But in the past, the medical schemes they don't pay for breast reconstruction on the healthy breast, where there are some gap covers that pay additional funding out for that. So very important to have a gap cover here. There's also cancer diagnosis benefits on a gap cover, so you can use the money that's released from that to maybe fund something like this. So very, very important to talk to us. For that, there's refractive eye surgery. It is according to protocols, but there is an amount for that, so that's very nice. And then they've included co-payment if you don't use the correct day hospitals, or if you do something in hospital that could have been done in the day hospital, of 2,746 Rand. So just take note of that. Again, something that you can claim from a gap cover, so very important to talk to us. International travel cover is as it was. So a little bit of explanation on how this option works is you've got a savings account. Everything is paid from your savings first, and then second, it will be paid from what we call your scheme benefit. And then whatever savings you carry over, so say in 2024, you didn't touch your savings, in 2025, that will be carried over and it will form part of your vested savings. And then you will be able to claim from there also. So once your savings have been depleted, you go through your scheme benefits, and after that your vested savings. So just so that you kind of know how it works, you get 13,000 Rand scheme benefit with a single person on this option. But as soon as you're a family, it becomes 26,000. And this is why I said it's good to split families, like the husband and a child, the wife and a child, because then you essentially get 52,000 Rand if you split it, and that's only on your scheme benefit instead of just the 26. Again, that's why it's good if you're a single parent. It's a great option because you have access to that full amount should you have one additional member. So the savings on this is also quite high. If you look at this, sorry if I'm scrolling like that, this times 12 is what you will receive in your savings account. So just to have a look at this very quickly, if you're a principal member, an adult dependent, and a child, let's say that's roughly, excuse the math, but let's say that's 2,000 Rand a month, you'll have 24,000 Rand in savings for 3 people on here, and that 24,000 Rand will be added here, meaning you have 50,000 Rand worth of day-to-day for a husband, a wife, and 1 child. So great option out of hospital. So first things first, you will use your savings account, the 24,000 Rand for 3 people. You will use that first, and then once that's depleted, your consultations of GPs and specialists will be paid up to 5,459 Rand. Once that's depleted, the benefit has been exhausted. You'll have everything else, but you won't have any consultation benefits. Or you might not use this benefit in full, but you have depleted your 26,000 Rand. as you claim from every single benefit on here. And if that 26,000 Rand has been depleted, then your medical scheme has been depleted. So then there's no more day-to-day benefits left for the year. All right, dentistry, again, savings first, and then up to a limit of 10,142 Rand. So often people would say dentistry is expensive, and it is, and they need to do something like an implant or whatever, something that's very expensive, or orthodontic procedures or stuff like that. And then this is just a little bit of planning, because if you've got a child that needs braces and you do this in the beginning of the year, January, February, March, and you've got your 24,000 Rand plus your 10,000 Rand, you actually have 34,000 Rand for dentistry benefits. And then of this 26,000 Rand, you would have then exhausted 10,000 Rand of it from your dental benefit, and you'll still have 16,000 Rand for the year for consultations and medicine and things like that, though no dentistry. So I hope that makes sense. But 16,000 Rand is still then quite a decent amount that's available for the year for day-to-day benefits. In this example, I'm talking about a husband, a wife, and a child. So if you're a single person, it might be a little bit different, or just two people. So just keep that in mind. You've got your medical apparatus. So this is for CPAP machines. It can be for artificial limbs, like it mentions here. It can be for quite a lot of stuff. This continuous flash glucose monitoring systems form part of it. It's wheelchairs, crutches. There's quite a lot of stuff that gets paid from that. So very nice that you've got access to that. Hearing aids, 10,000 Rand every 2 years. I'm saying 10, it's 9,678. Supplementary services is a broad blanket case for everything that's not a GP or specialist. So this is homeopaths, physiotherapists, biokineticists, that's psychologist. There's so many things that's paid from here. And you've got 11,000 Rand for that. So that's also nice. Bestmed Pace for the wound care. Right, then you've got an optical benefit. I think that this option has quite a good optical benefit. They cover you for 1,200 Rand for a frame. They do pay for the lenses and whatever on this as well. Just take note, it's for PPN provider, but most optometrists are part of that. If you don't use PPN, this is the amounts that they will pay out. Still very good. And then 2,000 Rand for contact lenses. Just know that it's a 24-month cycle with this. So if you're wearing contact lenses, they might only pay for 6 months or maybe 12 months. You'll be out of pocket for a year. So just take note of that. What's nice about this benefit is this does not form part of your overall day-to-day limit. So this is a standalone benefit, which is great. You've got your entire benefit plus optical benefits. Then you've got radiology and pathology. So that's basically your black and white x-rays and blood tests. So that's covered. MRI and CT scans we've talked about. That I'm going to skip. You have on this option, you have your chronic medicine, which is paid in full. If it's not part of the formulary, there's a 25% co-payment. And you've got 7 additional conditions that covered up to 9% of scheme rate, and then also 25% if it's not part of the formulary. So just know that sometimes there can be some odd situations here where you buy medicine of 1,000 Rand and you've got a 600 Rand co-payment. But that's because the medicine that you buy, the co-payments and all of that's worked out on the medical price reference list. So if something is 100 Rand, as an example, on the medical price reference list, and you buy something of 200 Rand, all of these co-payments is worked out on the 100 Rand, and you'll still pay for the difference between the 1 and the 200 Rand. So there are situations where you might pay a little bit more than what you bargained for, but at least it is still covered, and there's always the option to change the medication to something that's covered better. So very important for that. Then you've got your acute medicine, which is your scripts, 1,800 or 5,800 Rand, and you've got over-the-counter 1,161 Rand. So that's there also. Okay, chronic conditions. So the CDL conditions is the same as on all medical scheme options. It's asthma, bipolar, just looking at some of them, and then diabetes, epilepsy, glaucoma, hypertension, which is high cholesterol, hyperlipidemia, high cholesterol, hypertension, which is high blood pressure. So those are the more common ones. And then they've got these non-CDL conditions. So acne, ADD, which is great. And then we do a lot of stuff for eczema, major depression is very popular for a chronic condition, and then also gout. So those are the ones that we claim for quite regularly. And these additional conditions, non-CDL conditions, is covered up to 16,000 Rand for the year. So if you've got a child that's suffering with ADHD and it's 1,000 Rand a month for the Ritalin medication, this is a great option for them, because you can actually get the bulk of that medicine covered from this option. So that is a smiley face. Okay, so furthermore, there's a lot of preventative care on this. The flu vaccines covered for everybody, pneumonia vaccines for kids under the age of 2, and adults that's identified by Bestmed. Your travel vaccines are covered. Pediatric immunizations, which is very, very nice, is covered on here. It's the state recommended program, so there are stuff like meningitis which they don't cover, but you can just get that out of pocket. And then you have your female contraceptives up to 2,678 Rand for the year. The UIDs that are paid for once every 5 years, so that's very cool. Preventative dentistry I'll discuss now. And then there's mammograms for ladies over 40, PSA screening for men over 50, HPV for all the ladies between 9 and 26, and then pap smears for 18 years and older. Very important with all of these pap smears, mammograms and all of that, is that the test is paid and any consultation fees is not necessarily included and will come from your day-to-day benefit. Preventative dentistry is very nice. So kids under 12 can go twice a year for the consultation. Over 12 is once a year. They do their photo, scaling, polishing, fluoride treatment, and a very cool one for kids up to 21. Visual sealing prevents their teeth from decaying. So very, very nice to do that. Right, maternity benefits. If you're on this option, you're planning a family. 9 antenatal consultations, 1 postnatal consultation, 2 2D scans, and then they also pay for the vitamins. So you register on the Bestmed baby program, and you've got access to all of these. So, and what's nice is that you also get the immunizations. So on this option, it's really a great benefit for those who are planning a family. And that, ladies and gentlemen, is Bestmed Pace 1. And then from my side, this is a great alternative to those that are on Beat 4. I'll do a video on Beat 4 as well. Pace 1 is a lot more affordable, and the benefit reduction is not so big that you should not consider it. So if you're on Pace 1 considering an upgrade, rather reach out to us so that we can look at what's the next best option for you, because it might not be Beat 4, which is the best range, or the next option in the product range, but rather if you are on Beat 4, I would highly suggest that you reach out to us and consider downgrading to Pace 1 and save some money and rather add a good gap cover. Right, ladies and gentlemen.